Hi, my name is Gladys. I'm a third-year student here at the University of Texas at Austin Pharmacy School. I am originally born and raised in New Jersey. I came here to Austin about 40 years ago, and I am a non-traditional student, 43 years old, coming to the university.
I'm originally from San Antonio, Texas, not too far away. I'm the same class as Gladys, P3, and loving it here. And we heard about E2P not too long ago, like a few weeks before school ended. And for me anyway, I thought it was a super interesting thing to be involved in, especially because in our curriculum, we don't have a lot that we learn about in regards to HIV. We do have a pharmacotherapy module, but I felt like this would be extra enrichment for us. And especially like in community pharmacy, I know it's an important aspect, and like ambulatory, which is what I'm interested in. So I thought this would be like a really great way to supplement that.
And I have been working in a community retail setting for over 19 years. And when I seen the E2P program, I felt that it was something that was important for me to be able to take and learn from so that I can implement that to future patients. I believe that the information that they gave me during this program is going to align with what I need to provide to patients in the future. It's going to help improve health outcomes. It's going to help me to be overall a better pharmacist with better understanding of patients currently living with HIV or those that might be a benefit to take HIV PrEP medications.
And one of the big takeaways that I had from this workshop was probably just highlighting the racial disparities that HIV tends to affect, especially like people of color and Hispanic population, which I know is a very big population, especially here in South Texas, Central and South Texas, and also how there should be more campaigns to spread awareness, and we can even do that locally on campus. And some of the things we can do, it's not that hard, or it wouldn't take a lot of money, and we realize that throughout our workshop. So it's something now as pharmacy students we can implement, and then also take into our future careers, especially with like counseling and just spreading awareness to patients. So I think those are my big takeaways in learning how to do those things.
And mine as well. I believe the same thing she does, that there are a lot of health disparities. I have worked in a rural setting where it's very hard for patients to get access to care. And so pharmacists are a vital part of their healthcare team, if not the only healthcare individual that they're able to see. So this program has given me the confidence to be able to speak to patients about HIV preparedness or HIV treatment. I feel that this is going to be crucial moving forward for patients, especially in a rural setting, which is where I intend to see myself in the future. And I believe that they gave me the ability to be able to take an idea and formulate that into a plan that's actually feasible moving forward into the future.
And we've had such a great time.
Yeah, it's been fun. Like, it's not only learning, but it's a lot of fun interaction.
And just hearing from the experts from Duke and Mercer and whatnot. And we really appreciate it.